With your hosts, Lily Mundy, Raj Parikh, and Kyle Sanniec, this is the award-winning PRS Journal Club podcast.
Hi everyone, and welcome to the April 2019 edition of the PRS Journal Club podcast. I am Kyle Sanniec, PRS Resident Ambassador from UT Southwestern, and I am joined by my co-resident ambassadors, Lily Mundy from Duke University and Raj Parikh from Washington University in St. Louis. Today we have the honor of being joined by Dr. Rudolf Buntic, Program Director of the Hand and Microsurgery Fellowship at the Bunty Clinic, Head of the Division of Microsurgery at California Pacific Medical Center, Associate Professor affiliated in Plastic Surgery at Stanford, and Clinical Faculty Member of the University of California. Thank you so much for joining us, Dr. Buntic, for this PRS Journal Club podcast.
Thanks so much for having me.
The articles that we will discuss can be read for free on prsjournal.com, including an archive of all past Journal Club articles. The next article we will be discussing is Abdominal Etching, Surgical Technique and Outcomes by Tariq Husain and his group out of Miami. So the purpose of the study was to explain the author's nuances in abdominal etching, and as well as his outcomes and complications of 50 consecutive patients. He starts the paper by discussing his indications for surgery, kind of how he does his standard liposuction evaluation, looking for skin tone, striae, making sure BMIs are appropriate, targeting the amount of intra-abdominal versus subcutaneous fat. He then talks about his marking technique, how he marks out the musculature of the linea alba, linea semilunaris, the iliac crest indentation, and possibly the serratus anterior for a more aggressive etched look. His technique goes further in depth in terms of how he goes first through the deep layer with power-assisted liposuction, the different cannula types, and then how he targets the superficial layer with only 10 passes of a blunted 4 or 5 cannula. They have a pretty extensive section on his compression patterns, and equally important in their eyes is the use of a dietitian and a nutritionist for a post-op exercise and nutrition plan. When they looked at their results, 50 consecutive patients, the average age was 36 with a BMI of 26, and it was evenly split amongst male and females. There was a 98% satisfaction rate of patients who had had it done again, and they had the minimum follow-up of 27 months. They had no major complications requiring a trip to the OR or an inpatient admission. They did have a 22% complication rate overall with a 10% seroma rate. And of the 50 patients, 6 of them had contour irregularities. When they did a satisfaction survey, they ended up having a 96% satisfaction response. So in conclusion, they found that etching could be performed safely, and when using these surgical guidelines they set forth, the novice plastic surgeon who wants to start etching can do it in a safe, reliable, and reproducible manner. So my thoughts on the study and why I chose this is because this is starting to become a big push at all the meetings. It's kind of this high-definition liposuction, abdominal etching, kind of the next level in body contouring. That articles from Hoyos and Wall have shown amazing results, and this article here discusses kind of salient technical pearls for people who want to add abdominal etching to their armamentarium. But I think, with everything, there needs to be some caution. A key point readers should take home is that this is a technique that needs to be performed cautiously. Etching, as we know, is creating a contour deformity with the intention of giving that shadow an illusion of definition kind of around the musculature. So it's not something that should be used on all patients. It's not something that should be used for someone who is the importance of post-op compression after aggressive liposuction to really ensure that the etched areas get further compressed and defined, and the longevity of it. It's not just a 1 or 2 week thing, but a 4-week course to help diffuse the swelling throughout. The other thing that not a lot of people have talked about in articles currently is the use of a dietitian, a fitness regimen, to ensure patients are able to maintain their body habitus post-op. And this is probably just as important, if not more important, than the operation itself, because those weight fluctuations can significantly impair the surgical result. And that's one of those things that when reading this article, if you are going to try to perform this technique, is if you don't have the infrastructure in place of having patients on nutritionists and exercise plans, the weight fluctuations would definitely make me more weary of doing an aggressive etching technique. As I look at this article further, I'm a little confused on the satisfaction score being 49 of 50 patients for 98% satisfied, and then later when they used a standardized scoring system and a survey, it was 27 of 28 patients were satisfied. I'm just not sure where the discrepancy is. The other thing is a quarter of the patients roughly developed a complication. Now, none of these required operative intervention, but anytime you go into an elective aesthetic procedure knowing that 1 in 4 of the patients are going to have some kind of complication, I just think it illustrates the need for caution with this technique. And even in the literature, they discuss an average complication rate of 8.6%, so theirs is slightly higher than this. And then my final question with all these high-definition etching techniques is, when you're creating this dermal scarring, what is this going to look like throughout the lifespan? So, their average age is 36. What are the patients going to look like when they're 45 and 50 and have had these normal changes in body habitus? Even if they maintain the same exact weight, are these contour irregularities going to be more pronounced when the patient starts carrying weight differently as they have aged? So, my question first to you, Dr. Buntic, is what do you think of this technique? Have you ever used kind of the high-definition liposuction or abdominal etching in your practice?
I have the same questions you have. I have not used this technique. The paper was really compelling, very interesting. I had exactly the same thoughts as you had. One thing I really liked about the paper was there was a video that showed how the author did his markings, and a short video, I wish it was longer, of his etching technique. It would have been nice to see more than that. My concern is, like you have, with weight fluctuation and what happens to this over time. Is it something that disappears? Or if a patient gains, let's say, 20 or 30 pounds later, are there multiple abdominal pin cushions that are being created? And instead of getting one big abdominal pannus, if a patient gains 30 pounds or so, are there going to be 6 abdominal pannuses? I'm not even sure that's a word. Maybe the word is panini. I just don't know how to picture it many years down the road. It's very interesting. Some of the results are very compelling. It would have been nice to see not only pictures, but it would have been nice to potentially see a video of the post-operative result, to see the patient moving, to see what the shadows are as the light moves, and maybe to see a patient doing a sit-up or something, to see an abdominal flexion, to see what happens to those areas where there's etching and how they react to abdominal movement.
Yeah, I think that's a great point. A lot of the photos we see, they look very impressive, but it's what are patients going to look like when they're out, outdoors, whether it's at the beach or, in bathing suits, when they're, really wanting to show off the definition that you're creating for them, and they having noticeable contours when they're turning or sitting or standing up. And I think that's probably just more for the field of body contouring in general, probably the next steps and, evolution of how we critically evaluate it, not just from a standard plastic surgery photography perspective of someone standing straight ahead in an AP position in front of a camera, but more of this dynamic movements to see how the light shadow is cast and what they're like in their everyday activities, not just in a standard two-dimensional setting. My other question is, what do you think of the exercise and nutritionist program, and how realistic do you think this is in the average plastic surgeon's practice?
It's interesting. When we do hand surgery, we have a patient see a hand therapist. If we do head and neck reconstruction, we have this patient see a nutritionist and an occupational therapist. Orthopedic surgeons have patients go to physical therapists. You do this cosmetic surgery like a liposuction, and you just set the patient free. And this concept of having the patient see a dietitian and having the patient have, a personal trainer, to me seems like a great concept. It makes sense. And it's almost like taking some of our reconstructive techniques and applying them to aesthetic surgery. The issue would certainly be the cost. It would be great if everybody had a personal trainer who they could work out with. We'd all be better off for that. But I think it's a smart idea, and it makes sense in terms of the aesthetic practice and what these surgeons are doing.
Yeah, that's a great point. We wouldn't just do hand surgery. We wouldn't do, a toe to thumb and then not have them see a therapist. We wouldn't have that as part of our practice. And, in body contouring and aesthetic surgery, maybe this is another avenue that we need to start looking at as plastic surgeons, is not just the initial operation, but making sure that that operation is maintained over the course of several years. Lily, what are you guys doing out in Duke? Are you doing any high-def liposuction? Are you just doing deep layers? What are y'all doing?
At Duke, we're primarily doing deeper layers. We don't often do sort of any abdominal etching, short of maybe, a little bit of etching of the linea alba or something like that, maybe in some of our patients. That being said, we're not really high volume cosmetic center as this group is out of Miami. So I thought some of the really interesting aspects of this article, as were mentioned, are their techniques and their practice model, including their, dietitian and personal trainer and just sort of their techniques for marking. I think one of the limitations in thinking about this article, I am someone who has an interest in patient-reported outcome measures and, evaluating them and designing them. And I think if I'm interpreting what they did correctly, the authors created their own questionnaire based on a previous questionnaire that they had created. So this would sort of be an ad hoc measure. We commend them for using thinking about patient-reported outcome measures and trying to ask patients how they feel about these types of procedures. But I do think they didn't, quite take full advantage of their opportunity when using a questionnaire that the authors sort of had created as opposed to something that's rigorously developed and validated. And again, like you mentioned, maybe their 98% satisfaction rate came sort of relatively in the short time period right after surgery, just with a question to the patient, are you satisfied or not? But then when they reached out to these patients later on, it was a little bit lower. So I think overall, interesting and definitely technical things for us to take in as trainees, but just sort of reminds all of us in thinking about our research how we can design more rigorous studies based on the tools that we're using to measure our outcomes.
Raj, what do you think? What are you doing in St. Louis with body contouring and liposuction?
So our experience, we have in-house aesthetic, like our program director is an aesthetic surgeon, and we have in-house aesthetics, so we get a pretty good exposure to liposuction and body contouring. I think in the last few years, and this is probably the trend nationally, is we've seen, specifically in regards to kind of high definition liposculpture, so to speak, or abdominal etching, we've seen kind of an increased population, specifically in males, and I think that meets the trend of an increase in male plastic surgery recently that a lot of people observe nationally. We haven't done a lot of these procedures in the sense of the way they do them. It's just not that common for people, at least in our population here, to kind of be in that body habitus where they're close. I think this is definitely an operation that has to be done on somebody who's already, at least for the most part, relatively fit, and then just needs to kind of have that abdominal etching or to take them to the next level. I don't think this is an operation you do on somebody who meets the standard definition of having liposuction in many ways. And unfortunately, in our population in Missouri, it's just we don't have a lot of these patients that could both meet the criteria but also afford the cost of the operation. So we haven't done a lot of these. My experience with it is pretty minimal. Certainly I've seen a high volume of liposuction. And what I have seen in some patients, and I think conceptually it makes sense, is people doing Kybella in the outpatient setting for kind of abdominal etching and to have more definition. Like these are patients obviously that are sponsored through the resident clinics, so the cost of the product is frequently absorbed through the kind of the teaching mechanism. I don't think the cost of doing that down the road, requiring multiple treatments, is cost effective at all. So I think this is something that's interesting to me. I think it's something that if you're going to do it in your practice, that you really should spend time with people that have a high volume of doing it. I don't think it's a natural transition from just doing regular liposuction to doing kind of the high definition liposculpture. I agree with what you said, Kyle, where you should really be cautious and safety is important, and not just kind of thinking because you know how to do liposuction, you can just jump to doing these kind of techniques.
Yeah, I think it's definitely a learning curve. Maybe you start with just doing some definition just on the linea alba and the semilinear lines, and then go from there. Dr. Buntic, just kind of more broad-based questions. What is the role of compression for you in liposuction? What do you use? How long do you use it?
We use a similar technique that these authors use, obviously not for the etching. We use the foam padding, tape it onto the abdomen, and then use a binder to keep that compressed. And I think that does an adequate job. Certainly in the average liposuction, you're not going to see the seroma rate that these surgeons saw. The seroma issue was interesting to me, but at the same time, I think a seroma is something that's very easy to manage. Doing seroma drainages in the office is not that big a deal. The issue of having to do some repeat liposuction in a couple of patients was interesting, and to have to do some fat injection in another patient was interesting. In addition, I just want to add that there were some things in this paper I didn't like. I thought it was a little bit haphazard in the way it was organized. Some of the methods were presented in the results area, and originally a satisfaction technique was described, and then later in the results they brought up a satisfaction survey and a questionnaire that they really didn't describe in detail, and it didn't quite mesh completely with the original satisfaction. And they also described a survey that was very sensitive and the term sensitive has a specific definition in medicine. And I would have liked to see a paper that's a little bit more precise and a little bit better organized. And that would have helped us interpret the results a little bit better.
Yeah, I think you're spot on with that. I think the take home is probably the technical pearls, the video, the markings, the nuances from that way. And then hopefully the authors and maybe this sparks some more movement from other people doing more aggressive liposuction to really take to heart kind of how to rigorously and scientifically look at the outcomes and specifically the patient-reported outcomes like Lily mentioned of how these aggressive techniques, they look amazing in podium presentations, but how are patients dealing with 4 to 6 weeks of aggressive compression and contour deformities and seroma drainages, and is the amount of time they have to put downtime they have, is it worth the results? I like to think it is, but it'd be nice for the next stage, the evolution of the high def lipo or abdominal etching to go into that realm.
One of the other papers that we discussed in our journal club was the article that had preoperative patient-reported outcomes, and that sure would be interesting in this setting. It's more expensive and time-consuming, but it'd be very interesting to have a study that had preoperative assessment of a patient-recorded outcome and then a postoperative assessment would really be fantastic in something like this.
All right, well, with that, I think that we will end the discussion of this article. Thank you, everyone, for a great discussion. If you like this podcast, please feel free to share with your colleagues and friends and rate us on the Apple iTunes Store. Also, remember to tune into the other 2 articles that we'll be discussing on this month's podcast. Finally, please join us for our monthly journal club on Facebook, where we will be able to interact directly in real time with this month's selected articles' authors. Go ahead and like the Plastic and Reconstructive Surgery Facebook page if you have not done so already. It is there where our monthly journal club takes place. And once again, I'd like to thank Dr. Buntic so much for joining us.
Thank you all.
Thanks for listening to the award-winning PRS Journal Club podcast. Please click, subscribe, and leave a ratings or review if you're enjoying what we do every day.